As a global leader in myopia management and eye health, HOYA Vision Care remains committed to be a science-based company, continue leading evidence-based myopia management and prevention around the globe.
At the 2022 IMC, Rucky Shah, David Edgar and I reported on a database of over 100,000 vision screening episodes in England, but our analyses were limited to visual acuity data. At this 2024 IMC, our colleague, Miriam Conway, is reporting data from our collaboration with Lee Pentland, who coordinates the Child Vision Screening Programme in Scotland. Each year, over 40,000 children aged 3 to 5 years have vision screening by orthoptists. Of those who fail, we have cycloplegic refractive error data on approximately 5,000 per annum. The proportion of our sample who were myopic increased from below 8% annually pre-COVID to 11 to 12% post-pandemic. Myopia's increased post-pandemic in this mainly Caucasian population with a strong link with living in flats or apartments. Increasing myopia in such a young population raises the risk of developing high myopia, emphasizing the importance of myopia control interventions.
Myopia became a global problem here, and especially in Asia and also in Taiwan. So we are thinking of a good way to intervene pre-myopic children while they are not myopia. And except outdoor activity and medication like atropine, we are thinking of optical intervention. So we are using the plano DIMS lens to the pre-myopic preschool children to see their adaptability and the visual complaints after wearing it. The DIMS lens is for pre-myopic preschool children that adapt well with very mild visual complaints. And the preliminary results in 6 months show very stable spherical equivalence and stable axial length and the stable central choroidal thickness. Plano DIMS lens can be another good option for pre-myopic children with higher risk of pre-myopia in preschool children.
Research that we've been doing is looking at the DIMS lens, and everybody knows that it's been a great success story, tested in East Asian children living in Hong Kong. When it was brought to the market in the UK, we were keen to see, because practitioners were asking us, does this work here for European children? So the purpose of the study was to look at how tolerable children in the UK found the DIMS lens, how well their visual function was operating through the DIMS lenses, and also obviously was it effective in slowing the progression of their myopia. So we compared our data from UK children wearing the DIMS lens to the Hong Kong data set. We had to restrict our age range to do that comparison because we'd actually extended. Compared to the Hong Kong data set, we tested from 5-year-olds to 15-year-olds. They looked at 8 to 13-year-olds. So we wanted to compare that precise age match group, and we found no statistically significant differences after 2 years of wear in terms of how much they progressed. So basically doing the same job in the Hong Kong Chinese kids as they're doing in the European kids. In these two quite different environments and two quite different populations, the DIMS technology is working.
So currently, the myopia research has focused on monotherapy, and the evidence that we have about combined therapy is really limited. There are a few studies out there, but there are no randomized controlled trials that have been published so far regarding combination treatment. This is a randomized controlled trial that has 2 arms. The first group is treated with atropine 0.025% plus single vision lenses, and the other group is treated with atropine 0.025% plus MyoSmart lenses. In terms of axial length, over 12 months, we found that the group that was on combination treatment progressed less than the group that was with only atropine plus single vision lenses. I think that combined therapy is a potential strategic treatment for myopia control, especially for those myopic children that progress despite monotherapy. So this gives us another alternative. We can combine them, and it might be a synergistic effect.
We have been involved in myopia management research for many years. So a lot of the treatment tends to be effective in the first 6 to 12 months. But after a while, then they stabilized. So it is important to find a method that can continue to sustain the myopia control effect. That is why we like to pursue long-term studies. DIMS spectacle lens has just completed an 8 years follow-up. We were very surprised because after 6 years, we stopped the follow-up and we thought that the participants will have their free choice to choose other lenses. But in fact, 60% of them stayed with DIMS lens. And we found that comparing those that continue with DIMS lens and those stopped DIMS lens and changed to single vision lenses, there is still a difference in their myopia progression. So the DIMS lens still protect the children from myopia progression and axial elongation. We also found that there are no adverse effects, and in fact, there were no evidence of rebound. So participants continue to benefit with safe wear. The DIMS 8 years data strongly suggested that myopia control have to continue even to adulthood. We show that among the 16 to 21 years old, there is still myopia progression during these years. So if they can continue with some myopia control methods, that would benefit them.
We strongly believe in partnership and collaboration on driving innovation, scientifically and clinically proven. At HOYA Vision Care, we believe that every child deserves better.